1 in 7 adolescents will experience at least one mental health disorder in their lifetime. That stat coming from the World Health Organization. Tonight, we're shedding light on the youth mental health crisis in our area through a Richland mother's lived experience. And we have to warn you, this is a hard story to watch, and it does discuss violence and suicide.
She loved to organize, she loved to decorate, she liked to make things pretty, and she was a skater girl.
Holly Roettger reminisces on happier times before her 15-year-old daughter Nana became mentally ill.
Like now I would give anything to be worried about her skating around Richland instead of what she's dealing with right now.
Last July, Nana's father was murdered. Holly says that's when she started showing signs of depression. Then in December,
she was admitted for her first crisis stay. And that is when we realized that from the age of 5 to 11 that she had been hurt by a family member. Never in a million years would have thought that my children were ever getting harmed. The one place that I considered them safe and allowed them to go when they were little. So she had been harboring and carrying all this, and the trauma of losing her dad and then the holidays coming caused what they call a mental break, and all of that came forward.
Holly says they've been on wait lists galore to get Nana intensive treatment. In the meantime, keeping her daughter alive has become a full-time job.
I have to go to the restroom, I have to shower, I have to sleep, and she purposely waits because she is so hurt inside.
Finally, in February, they were grateful to get into Lutheran Community Services, which is opening a new office in Pasco this month. But it's still an outpatient program. Holly says she just wants her skater girl back.
You just want them to understand how loved they are, and they don't. And it doesn't matter what you say or what you do, until they get better, they're not going to believe that.
Holly says they've run into many barriers just trying to find care.
Mental health needs more resources, it needs more attention. And I had no idea before any of this, no clue, zero clue. I would have been just like everybody else, thinking that, you know, if my child needed help, that they could get help.
Despite the sleepless nights, inability to go to work, and mental toll,
I'm not giving up on my child, and I never will.
Holly isn't throwing in the towel anytime soon.
We're just hoping that somebody sees us, somebody sees her, somebody sees this problem and does something.